It's a tandem presentation because I had no more time for placing both presentations, so it's a tandem one. But luckily enough, they know each other since many, many years. So the boss is Professor Francesca LANFRANCONI. She, do you want only Dr. Francesca LANFRANCONI? She's from the Fondazione MBBM, Centro ML Verga, whereas Dr. William ZARDO now is attached to here nearby, Istituto di Tumori. And they will talk about exercise and prognosis in children with cancer. The stage is yours.
Thank you, Gus, and thank you, Alberto, for having us and to recreate this beautiful femme sulla banda style that Professor Mognoni and Sabine for sure will have appreciated. And as many of you already know, William and I, we work in the field of exercise in children with cancer. And why you see a unicorn here? Because physiologists in these complex clinical settings are rare as unicorn, and we do not speak the same language of our colleagues, our pediatricians, our oncologists. And so we go around showing our beautiful outcomes and graphs to these clinical congresses, but they really look at us as a unicorn. And what really matters for an oncologist is if a new treatment can impact the prognosis of each children with cancer. Those are new evidences that we can impact the microenvironment of cancer also in children with cancer, but then the challenge is we can demonstrate that exercise has an effect on the prognosis as well in children, not really. And this is totally new in adult. Last year, finally, a group presented this research where adults with colon cancer, after having a structured exercise intervention, they had a disease-free event for 8 years after cancer treatment, if compared to those that didn't do exercise. So this is the first time that we had this type of evidence, and now the American College of Sports Medicine is asking, okay, if cancer is a pill, why we can prescribe it? And that's the point. That's why we are here with you, asking how you can help us in demonstrate this thing. And we have already trained a huge amount of young children and adolescents, and we have grown also a huge amount of new unicorns, exercise physiologists and sports medicine doctors, and both in Monza and in Milano, and those are beautiful environment for those that want to use exercise in children with cancer. And what we know for sure is that these young children and adolescents has a huge exercise intolerance due to cancer treatment, due to cancer itself, and also to bed rest. And the oxidative metabolism is impaired at any level. And those are the memories of bed rest campaign. We can train them from the start of the cancer treatment if we want to counteract the bed rest condition at least. And it is safe to do exercise in this population. Those are research of many groups around Europe. And we can adapt exercise, never avoid it. Now, what we want from you, you are the chosen one, you can help us in trying to find a way to demonstrate that exercise can impact the prognosis in this population. Now I will let William to add more pressure on your brave shoulders, and so the floor is yours.
Thank you, Francesca, and as Francesca told before, we know that children survived to acute lymphoblastic leukemia have a reduced exercise tolerance, and we ask. Grazie. Thank you. And we ask what is the prognosis for these patients, and these patients we know that doesn't reach the values of LTPs. So what is the prognosis for these patients? The same findings we observed in solid tumors, so a similar population. So these patients does not reach the values of normal LTPs, both in male and female, and again the question, what is the prognosis for these patients? What we have also found is that exercise can impact the heart rate and VO2 curve, and the patients that did exercise during treatment had better heart rate versus VO2 efficiency. So the question again is, what is the prognosis for these patients? So it's an open challenge. Some authors investigate the correlation between muscle strength and or cardiorespiratory fitness to the mortality, and may the exercise contribute to reducing cancer-related mortality. So in 2011, a very funny paper asked if there is a walking speed to avoid the Grim Reaper, and we asked your help to find variable. So this is the variable that we are measuring now in our study. So we studied electronic health records and questionnaire, digital monitoring, exercise test, body composition, blood. But if you have any suggestion, any advice to the variables, feel free to give us. And the other open question is, when should we measure these variables? At the beginning of the diagnosis, during treatment, at the end of the treatment? So this is also another open answer to you. So thank you for attention. Thank you, Gaspare and Alberto, for inviting us, and thank you for giving your suggestion.
Okay, so now you cannot ask questions, you have to give answers. Okay, and change the game. Of course, thank you very much.
That's the spirit. Thank you, Gaspar.
Yeah, fantastic.
Bruno Grassi from Udine. Thank you. But from what I understand, there is already very clear proofs that exercise improves the prognosis of many diseases, many oncologic diseases. It is demonstrated very well, or not?
In adults, there is some evidence,
children, okay.
Not in children and adolescents. They are a bit more tricky because we have also the age effect on them, on our classical physiological variables, outcomes. And as regard, for example, blood cancer, they are also really frail when we need to do some type of exercise testing. So we are using classical non-invasive measurement, but we have to adapt them. For example, as regard nerves, ischemia, we are trying to find new protocols without using the classical tourniquet, and so we are asking around your help. So maybe we are a bit stalkering some of you, but anyway, we need to prove this.
Thanks very much. Damien, very here on behalf of the Physiological Society and Editor-in-Chief of Experimental Physiology. So, in our hospital, it's becoming very divisive now with surgeons, in as much as they're becoming increasingly more switched on to simple, straightforward variables, like the gas exchange threshold, VVCO2, VO2 peak, which, as Bruno mentioned, there's a huge amount of evidence to suggest it's going to improve survival post-operatively in patients. So I would keep the metrics pretty simple and map it on to the adults, because there's a lot of data there that's driving that. And I think certainly in our hospital now, with the operable tumours, surgeons are becoming increasingly excited by what you would call the unicorns. We're becoming very popular because it is improving surgical outcome, which is good for the surgeons, and it's also improving outcome. And there's no reason for me why we shouldn't be seeing the same huge advances with exercise as we would with, for example, adults. So I would keep the metrics, as we've heard here, there's some wonderful work going on in terms of CPAT, to keep those metrics relatively simple and straightforward. They're very powerful.
Yeah, thank you. And that's very interesting because in adults, that work adults with cancer show an increase in those that were doing exercise of percentage of disease-free survival of around 8–10%. That is exactly the same amount of a new, very expensive drugs treatment. So we have effectively a huge therapy that we can use, and we are not using. So, but I agree with you, they like unicorns in hospital.
Thank you very much, Francesca. Thank you very much, William, for the unicorns. And I like to be a unicorn. Okay, we can move on.